Good evening. This is a public service announcement on chikungunya in Taiwan. Mosquitoes are known for carrying and spreading deadly viruses, including dengue fever, malaria, West Nile, and Zika viruses. Today, one of the most current and alarming threats in Taiwan is the chikungunya virus. Chikungunya is carried by two species of mosquitoes, the Aedes aegypti and Aedes albopictus. The current outbreak witnessed in Taiwan is said to be imported, whereby 19 cases have been reported as of July 30, 2019. Most of these cases are said to originate from Burma. So far, only one indigenous case has been reported in Taiwan. One of the major complaints of patients suffering from chikungunya is multiple severe joint pains. Other symptoms include swelling in joints, high fever, nausea and vomiting, rash, and this joint pain can restrict mobility to where it becomes difficult to perform basic tasks. To prevent and control the spread and transmission of chikungunya in areas where mosquitoes are prevalent, individuals must endeavor to dress wisely in light-colored clothing that covers most of the skin when going outside, use the use of mosquito repellents, draining stagnant waters to avoid breathing, and seeking medical attention immediately you begin to manifest at least two or more of the symptoms mentioned. At the community level, any cases or suspected cases should be reported to the nearest Department of Public Health offices. The Community Health Center will continue to provide education and mosquito nets to help prevent the disease. Communities at risk for increased mosquito breeding should also report to their local health department for proper control management, such as spraying. For more inquiries on the chikungunya virus and its potential impact on the Taiwanese communities and populations, visit the nearby health centers or visit the Taiwan Health Department website or the CDC website to learn more about the symptoms and control methods. Let us work together to eradicate chikungunya in Taiwan. Thank you.